Hi, I'm Ginille, a cosmetic nurse practitioner since 2013. I've got 3 medical spas, Jossie Skin and Wellness. You can find us in Los Angeles, in Torrance or Mar Vista, or in Las Vegas on the Summerlin side. In our office, we focus on treating all skin types, all skin tones, getting you natural looking aesthetic results, or still looks like you, just refreshed, never overdone. We are with our patients forever. We're with them forever, and we see them through all different life stages. And we build out treatment plans. We focus a lot on skin health, hair health, and then natural looking aesthetic injectables as well. If you have questions, please let me know. This is me. I have done all the treatments that I offer in the office. This is me prior to doing any treatments in I was 10 years ago. So this was 28 here, and I'm now 38 years old. I've got 3 babies. I can talk to you about all the treatments I have done. I can talk to you about treatments that are safe for Black and brown skin. We see a lot of women and men of color in our office, and it's just important I highlight that just because not everybody treats Black and brown skin in aesthetic medicine, and they don't take, the same considerations for these patients when they're treating them. Okay, so if you have questions on anything, please let me know. In the meantime, I can talk to you about treatments I have done. I can talk to you about the most commonly performed treatments that we do in the office. So any and everything. I will say probably one of the most commonly performed treatments we have and the most commonly asked questions we get about are, what is the natural filler? So natural filler is made entirely from your own blood. We draw blood from your arm. We spin it in the centrifuge. It separates out your growth factors and stem cells. We take those and then we heat it and cool it and make a gel out of it. We can inject that wherever we inject it in the face. Your body is going to make new collagen in that area over time. So a lot of people like this as an alternative to filler for that collagen stimulation. This is something that just gets better over time. We're not trying to go for the instant lift with this one. If you want instant results, that's where we're going to go with your traditional hyaluronic acid or calcium-based filler. With the natural filler, gradually your body making new collagen. It really works. I will say the healthier you are, the younger you are, the better the outcome, the better your body can make new collagen. I've been doing it only for the past 2 years. I haven't done any filler for over 3 years because I'm breastfeeding a baby and he's running me ragged, and he's 2. And I feel like it has really helped maintain the results. It's helped me not look so sunken, so hollow, which I usually look way more haggard breastfeeding this long. I have 3 babies, so I'm used to breastfeeding this long, and I'm used to feeling way more sunken here, cheeks, smile lines, like all the areas. So I've done my whole face with it. This first picture here is after I breastfed my first child, and I had lost a lot of weight. And so this is what I'm used to seeing, like when I lose weight, through temples, under eyes, smile lines, like the cheeks, everything just looking a little bit more sunken. And this is me, like after I've done filler, skin treatments, and then now 38 years old, maintaining with a natural filler and doing skin treatments. Hey Yazzie, I wish I had a place in Atlanta too. We're in Vegas, we're in Los Angeles now. I will say the top 3 places we get asked for are Houston, New York, Miami, and then Atlanta is a big one too. There was a question, let me see. Hi, I got platysmal band Botox and there's some pain in the area and some swelling. Let me see. Is this normal? If you just did it recently, like in the past day or 2, it could be a little painful, maybe a bruise, swelling maybe from a bruise. If it's beyond 2 weeks, that is not normal. I would just check in with your provider there. Hey Golden, if you have questions, please let me know. Oh, if you have questions on also, Zelsa, I'm going to add you in here. If you want, we can talk one-on-one, well, not one-on-one, one to whoever is here. We can go through your questions and goals as well. Hey Zelsa, if you have questions or anything, let me know.
Yes, I would like to know if I schedule an appointment in Torrance, I'll be able to meet you in person.
Yeah. So I see patients in, I'm sorry, I messed up something here. I see patients in all the offices. and I'm in all of them. So I totally go there. I do virtual consults with almost everyone before they come in because I want to go through your questions, your goals, like tips on what to expect, how to prep for treatments. So really have you prepared before you even come in for your treatment. We start developing your treatment plan during our virtual call. And then the virtual consult is $150. That goes towards your treatment in person, as long as you do the treatment within 3 months from the time we did it. But yeah, it's just time for us. The only thing I don't do is like Botox only appointments, just because majority of the patients I'm seeing, we're doing like their full face and we're doing skin treatments. So that's the only thing. If it's Botox only, you'll see one of the other nurses, and the whole team is excellent.
All right. But that got me a little bit confused because if I pay 150 for an online consultation, does that mean I still have to pay an extra 350 for an in-person consultation?
No, just the 150. And then when you come in, that 150 goes towards your consult. 350, some people like either they don't want to do virtual consults or they can't figure out how to do it. And they're like, I just know I want to come in. I want to get treatment that same day. They've already researched, I've been making videos for 5 years. So they've already researched enough. And they're like, I know I'm going to come in. And that 350 is just for them to be applied towards their treatment that day. We just do that so people are not like, oh, I just want to come in and like, I'm going to think about it. We just want to make sure we're reserving appointment times for the patients that are ready to do the treatments.
Okay, thank you so much. Um,
You have other
I would
questions?
like to get some procedures done, but I think it would be better to discuss it. So I'll just book for my appointment right now.
Okay, yeah, you can do it online. And then, like I said, during the call, we'll go through like everything, and we can talk through what do you do skincare. We can talk through all the stuff. And like I said, give you information on how to prep for your appointment. So then you're just ready. We'll build out the treatment plan. Pre and post care, we're going to review, and then we'll send it to you after. We send you information about everything we discuss as well. Pricing, financing, like anything you need to have you ready for your appointment, we do right then, like we send it to you.
Okay, thank you.
Yeah, I look
Bye.
forward to seeing you. Have a good one. Happy holidays.
You too.
Okay, let me see. Online consults are, they're not on Zoom. It's through our electronic medical record. If you do it through the top of my page, if you hit the link through there, that's where they will be booked. It's just a HIPAA compliant platform. So that is where we do the consults. I hope you're doing so well, Gym Seeker. How much is the average for first time fillers? It depends on what areas we're treating. I would say, like, to give you a general estimate, like if we're treating through mid face, usually between 2 to 3 syringes, lower face 2 to 3 syringes. Syringes are $9.75 each. When I'm seeing patients with the other team members on our office, it's $8.75 each. So in general, I mean, you can say between, this is like a rough estimate, 2 to 3,000, 2 to 3,000 when we're looking at the face. It's going to vary depending on the person, depending on like how much hollowness they have, what their natural, like what they're starting with at baseline, and then what their goals are. So if somebody's like more sunken, they're older, they're probably going to be doing more. If it's somebody younger and she's just noticing like a little bit of stuff, she wants to soften smile lines, they're going to be doing less. I can't know 100% until I can talk to you, but that's like a general idea of the numbers. And yeah, I hope that helps you there. But we can totally talk through more of these. Oh, if somebody, let me see through here. Is it different? How can you determine if someone's a good candidate for Masseter Botox? So for that, we go through, we go through your like history. Are you having symptoms, clenching, headaches, teeth grinding, jaw pain? And then I have like a whole list of questions I'm asking you. How long have you had this? What makes it worse? What makes it better? What have you tried? What have you failed? Is one side worse than the other? Like, tell me on a scale of 1 to 10, how bad is it? All of those questions.
Okay, you rest. Since you're fine, you're the talk.
Hello?
Mm,
Uh-oh. I don't know.
mm,
So I won't be able to like fully assess you and feel you, but those are the questions I'm going for. And then I can give you a general idea of how many units that we're going to be doing. Talk about if it's just in your masseters and or the temporalis, if it's for TMJ. If it's just for slimming, it's like a general range, like 20 to 30 units per side into the masseters if it's just for slimming. Slimming, you'll see gradually about 2 months after your Botox is kicked in and those muscles have had time to atrophy or relax, like they're not flexing all the time, so they've relaxed, and then slimming can happen in the lower face if your lower face is wide from overuse of the muscle. So a lot of people will start noticing if they're always clenching down, they're like, oh, my face looks like more boxy, more square, it looks really big. That's when we can use Botox to relax the muscle, and they'll start to notice slimming gradually. Okay, let me, if I do masseters to slim my face, will it help create a jawline? And I have some good before and afters of TMJ Botox and like masseter slimming. It can, it just depends on your face. So some people will come in and they're like, I want you to slim my face, and I'm trying to feel their muscles. I don't feel their muscles flexing at all. They don't have any TMJ symptoms. And if their face is just round naturally, and it's not because they're overuse of this muscle, TMJ Botox is not gonna make it slim. Okay, I'm trying to go back up and make sure I didn't miss any of these. Okay, we talked about, I want my face fixed, Miss Toulon. I want my face fixed, hollow and puffy eyed. I'm done crying. I just want to look rested. The money is here in Nashville. Nashville. That's another spot. Okay, I have to think about that one. I have patients from all over the US. And like every time I'm in clinic, I see somebody from outside of California, outside of LA, outside of the US. So she said Nashville is there. I will have to add that one. I just have to end up getting my license in all these different areas. It's not that bad. Okay. Oh, thank you so much for the hearts, Let me see. Okay, I'm just scrolling. We talked about where we're doing it, where we're located in Los Angeles, Mar Vista, Torrance, and then in Summerlin side of Las Vegas. 2 injectors told me I don't need lip fillers. Should I get them anyway? I have to, let me see if I can look at your picture. So beautiful. I can't, without like being able to fully see your lips and assess, hard to know. Sometimes people will say that to black girls, because black girls look like a black girl, already have full lips, and they're like, no, you don't need more. I treat black girls with lip filler every day. And if they just want it more full, totally yes, as long as we're not overdoing it. So I'm saying without me being able to feel on you and see, I just want to make sure it's not puffy above the border. I don't know if you've done filler in the past. We also want to make sure that the lips don't dominate, like it's like really full on the lips, and then the chin is really set back. It can look a little off. Like we want to make sure things look balanced. So I don't want to, I'm like, do we need any of this? None of us need any of it. It just can help us look and feel more confident. Like, hey, that's cool. Thank you so much. Hope you're doing so great, Rita. If it's something you see and it helps you look and feel more confident, then that's the whole thing. Like, did I need under eye fillers? No, I didn't need it, but like, did it help me feel better about myself and not feel like I look so tired? Yeah, and I liked it. Okay, I'm gonna hit down. I wanna make sure if I'm inviting somebody. Okay, Tammy. The last was like a guy that I think was playing around. Okay, if you have questions, I'm gonna see Tammy. And thank you, Rita, so much. I'm doing so great. Tammy, can you hear me? Uh-oh. Let me know if you can. And then I'm gonna answer any other questions. I'm trying to hit do you only do consults, or do you also inject? Because of the website, there's no option for you. So yes, I inject. There's just not an option to like book specifically with me, because I want to talk to all the patients before we do it. That's my only thing. And so my team will like book out the appropriate time. Only to just book with me, the team will like help you with coordinating the appointment. But yes, I do all the treatments in the office, Botox, filler, skin treatments. I do everything. But I just like to talk to the patient so we can start developing that treatment plan when we're there. A lot of my patients are coming from out of town, so I don't want them to be coming from Nashville or from wherever, Houston, New York, Miami, and then they're like not a candidate for what they were thinking about. And we have a different treatment plan. Like there's just considerations I want to make sure that we're reviewing before the patient comes in. Tammy, can you hear me? I think she's there. If you have questions, Tammy, let me know. If I do masseters to slim my face, will it help? Oh, wait, I did that one. Where is it? And I think that was it. I had Bell's palsy years ago. So scared of bringing it back with any treatments. I mean, I use Botox when people have Bell's palsy, if they're trying to like relax the muscle. Like even for like some of my aunt, it's like really like more muscles were like over contracted. So we're trying to relax certain ones. I don't think it's going to, but I get your concern. Don't rush into anything with it. Tammy, if you have anything, let me know. Am I a licensed cosmetology or doctor? I am a nurse practitioner. I'm based in family medicine, but I've been doing aesthetic medicine since 2013. So this is what I do. I focus on natural looking aesthetic results. I went to Stanford. I went to Duke. I don't play around when it comes to your face. This is what I study. This is what I thrive at. I usually am like flipping through patient before and after, so I can flip through some of these just so you can see. We treat all skin types, all skin tones in our office. These are just some of the patient before and afters that I have like set up on my phone. We have thousands of patients. So I've been doing this since, this is what I do. This is what I do, it's faces. And I love it. My practice, I went on my own in 2021 and my practice was under Ginille Beauty Aesthetics, just my name. But now we have a whole team of providers. And so the clinic, we switched it to Jossie Skin and Wellness. So we just switched the name out. These are just some of the patients. I'm flipping through quickly so you can see them. I've been doing these treatments on my own self forever. I'm getting these treatments done. Okay, let's see. Is everybody okay, Rach? What does she say? I don't know what she's saying. I hope you're doing great. Do you suggest PDGF for under eye hollowness? No, Caroline, I would not do that right now. Not FDA approved for injections in the United States. It's too new for us to be using for aesthetic purposes. And some people were saying, yes, I did it and it was great. Other people were saying, yes, I did it and it was not great. And I have this long-term swelling. So anything that's not FDA approved, I'm not injecting in our office. So no. Tammy, do you have questions and I just can't hear you? If you have questions, let me know, okay? I think she's there. And if not, just let me know. Best to do for jowls. So jowls, actually this is a good picture right here. Jowls, when the jawline starts to look a little irregular, we start to, we lose volume, fat pads start separating. As we get older, fat pads start sinking. So the jawline will look like this. We call these jowls right here. You can see, let me see if I can make this picture a little bit bigger. There's a few things that we can do when it comes to treating the jowls. Non-surgically, like surgically, you can get like facelift. Non-surgically, this is a good one to kind of show. What we did is some filler in front of the jowls, into the marionette lines, the corners of the mouth, and then into the chin to kind of camouflage this area. We don't want to do it too much where it makes your face wide. We can kind of camouflage them. And then here she is from the side. And you just see the jawline looks straighter. Other things you can do Botox into these neck bands. That'll help give a little bit of tightening along the jawline. You can also do Kybella. Kybella is a permanent fat dissolver to get rid of fat. So you can inject through here to dissolve the fat pad. So those are some approaches we can do non-surgically for treatment of the jowls. Okay, I gotta read these messages. I am sorry, guys. Okay, let me see. Difference. What do I think of EZ Gel? I love it, Teresa. I do it. I've been doing it exclusively in my face without doing any traditional fillers for the past 2 years because I'm breastfeeding. When I very first did it, I was like, I don't see any change. This didn't do anything. But this is one that we're not going for that initial lift. This is one that gets better over time. So EZ Gel is made entirely from your body's own growth factors and stem cells. We draw blood from your arm. We make a gel out of your stem cells and your growth factors, and then we can inject that. So I've done it under my eyes. Now I've done filler. This was after my first baby. He's 11 now. So I've done filler, but I just did filler one time 10 years ago. And then these past 2 years, I've been doing the natural filler made from my own growth factors and stem cells. So I've done it underneath my eyes, into my temples, my cheeks, my smile lines, corners of my mouth, along my chin. So your body makes new collagen wherever it's injected gradually. So over time, it just gets better. So it's not a quick fix. If you want a quick fix, that's where we're looking at filler, making sure you're a candidate for filler. If you're not a candidate for filler, then we say, okay, let's pause. Can you do the natural filler? Everyone can do it. Just, I will say, younger, healthier patients are going to have better outcomes. I treat women up to their mid-60s. I feel like mid-60 gets a little iffy on results just because like the body can't make as much collagen at that age. But I treat ladies in their 30s, 40s, 50s all the time, and they really like it. Some people never want to do traditional filler. And so they like this, or they're not candidates for filler. Can you still hear me? I think you can hear me. So they like this as an alternative. I really like it. I don't know if there's any spot that I would feel like I need to go back to using regular filler anymore. And I love regular filler. I do it all the time, but like I do it sparingly in patients, and I want to do it the right way, and I don't want it overdone. Okay, let me see. Oh, he's got that. Best for Jowls. Talked about my license. Can you recommend? Uh-oh. It said, sorry. Can you recommend Allergan Botox, Daxify, or Letty Bobo? I would say try the different ones and see if you have a preference on them. In our office, we do Botox, Dysport, ZMN. Tell the patients if you have a preference on one, we can try them. A lot of people are like, I can't really tell the difference between them. We price them all the same because they don't want people to pick based off of pricing. I just want them to be able to use the product that's going to be right for them to get them the outcome they want. Tammy, yes, I can hear. Thank you for your knowledge. Oh, Tammy, I'm so happy to see you. I think you're in here, Tammy. If you have questions, let me know. Following from the UK. Oh, I had 2 patients today. Well, actually, one with her husband was in the UK, but the other's from the UK, and I've been treating her for a long time. Love your video and informative. I wish I was there too. And my license, yes, I'm a nurse practitioner, and in California, and I have my license in several states, but I practice in California and in Las Vegas. Hi, I hope you're doing so great. Okay, I am just trying to scroll back up there. Thoughts on EZ Gel and Sculptra. I told you guys what I think about EZ Gel. I love that. Sculptra is another collagen stimulator. This is one that gets better over time as well. It's just not made from your own blood plasma. So Sculptra, you can use it temples, mid-face. I've had it in the past. It's kind of like slow to see the results, but it works. Okay, let me see. I'm going back down. If I missed a question, please just, you can like add it in here. It's just a lot of these keep coming, so I have to scroll up and down to read them. Okay, yes, you can use both. Okay, noted. That's amazing on EZ Gel. Does it add volume like filler? Yes, but not the same. If you want like structure, let me try to show you. If you want like more angled, I wouldn't do it in the noses. I don't think it's going to give structure, but like for this guy, you want more like angular. It's not going to give me that with EZ Gel. This is more just like soft volume, not a ton for like really, if somebody wants really contoured, I wouldn't say that EZ Gel is going to do it. If you want to get the PRP, other tips I would say are have a healthy diet, take your vitamins, try not to drink, smoke. Like you want your body to have the best environment to make new collagen. Oh, that's me a long time ago before Botox. Goodness gracious. For cheek filler, and I feel like it didn't do justice. I just got cheek filler and I feel like it didn't do justice. Tell me more about that, Phoenix. Kitty said that looks great. Okay, I think that I need that right now. I'm trying to, Sujia. Yes, I was Sujia earlier. EZ Gel for eye bags. For hollowness, yes, not to take away fat pads. I'm going to try to see if I have any eye bags on here. I do treat people with like herniated fat pads, like the big bulging fat pads. This is one, but this is not what I'm talking about. I treat people with like bigger ones. I tell them, I'm like, I can't take away the fat pad. Only surgery can, but I can camouflage it. If they don't get puffy around their eyes, if they don't cry a lot, if they don't have bad allergies, then they can do the traditional filler, or we can look at natural filler. Okay, we talked about EZ Gel. EZ Gel, is everyone okay? How do you know which injector to trust? That's a good one. Do your consults. You want to make sure they're licensed. I know somebody earlier was asking me about my license. Like, make sure they're licensed to perform the treatments they're performing. You want to look at their before and after photos. You want to see people that look like you. You want to make sure you like the results of their before and afters. That's really important. Read their reviews. That's a big one. I tell people all the time, like, read our reviews. Like, read our reviews. You can see it. If you look under Ginille Beauty, if you look under my name, you can find, we have hundreds of reviews from our patients. Our patients make videos themselves. They share their before and afters. And I always say shout out to our patients for allowing us, for consenting, for letting us to use these to just help educate what natural looking aesthetics can look like. Again, we treat all skin types and all skin tones in our office. And I have a lot of people that tell me they've never seen anybody that looks like them. They're like, hey, I didn't know, like, a black girl or Indian girl or a girl that looks like me gets this stuff done until I came across your page. So that's really cool for us, because if it weren't for our patients like sharing their before and afters, you wouldn't think that, just look at her after photo. Look, this is the after right here. You wouldn't think if you saw this girl walking down the street that she's had a bunch of filler in her face. That's the whole point. Like, I never want it to look like you've had work done. We just want it to look refreshed. I want it to look like you were born this way. That's always the goal. So we just want to make sure things look balanced, harmonized, not overdone. But because it looks so natural, nobody would know. And so if it weren't for the patients showing their before and afters, you know, people wouldn't know that this is what natural looks like. Oh, well, I can look like this, and it doesn't have to be crazy. Before I got into aesthetics, or when somebody offered me this job, I was like, I don't want to do that. I thought everybody's going to look crazy and big lips, and like, it doesn't have to be like that. As you can see the patients. And then, like I said, do your consults before you decide to do any treatment. Do your consults, ask questions. You can do multiple consults. You don't have to trust. Even for me, I tell people, I'm like, I will tell you all the things. I will tell you limitations about these treatments. I'll tell you alternatives. I'll tell you if you're like, oh, should I do it? Shouldn't I do it? I'm gonna be like, nope, don't do it. Like, I'm gonna be the first one to be like, no, wait, research. I'm not gonna be the pushy one. I'm not here for people to make rush decisions. I'm here for people to help them make informed decisions. That's the biggest thing. And if they're like thinking about it, or like if they have hesitation, I'm like, don't do it. It's not worth it. Because also when you go through this, guys, you can bruise. You can see her right there. She's got a little bit of like redness after there. You can bruise, you can swell. Mentally, it's like something going through the bruising and swelling process. You might like it when it's swollen because it looks more filled out, or you might be like, what the heck? So I don't want you to be freaking out even more because you're thinking, oh, I shouldn't have done this. Oh, she told me to do it. No, I'm always gonna be like, no, don't do it. Think about it. Wait, there's no rush with this stuff. Don't rush on your face. I'm not here to rush on your face. I don't want you making rush decisions on your face. That's another reason why I do the virtual consults with people before they come in. I don't want people to come in and just feel like, you know, oh, I just want to do it because you're here and I don't want to waste your time. I'm like, that's not a reason to do it. Like, we want to go through all your questions, your goals. I want you to understand this. I want you to make sure it's a good time for you to do it because you can bruise, you can swell. We want to think through all the things before we decide to inject. I think people end up messing their faces up when they do too much. They do it too quick. They're just deciding willy-nilly, oh, I'm going to do this. I'm like, no, that's not the point. Okay, is this all Botox filler surgery? These are all non-surgical. So these are all Botox fillers, skin treatments, that we have on these results. So nothing with surgery. I don't do any surgery in my office, but we can do some referrals if we know a good fit for you. Oh, so these are some noses. And a lot of people are like, what can you do for like a black girl nose? So for her, she wanted to like build up the bridge and create a little highlight there. You can camouflage a bump. You can lift the tip of the nose. For her, she felt like when she smiled, the nose tip went down. She wanted it to go upwards. So there's different things you can do with noses. And this is really cool because, like, no, you don't have to go through a surgery. Like, we did this in a few minutes and she's able to, like, you can see she's like feeling happy. Like, you can get a surgical like result without surgery. And I really like this. We did this one over 3 sessions. She was like, my family said I can't do nose job, but they said I can do nose filler. And so she did that and she loves the results. And I say it lasts 1.5 to 2 years. Most patients, even when she came back, it was still straight. This is beyond 2 years. This other girl came back, her nose was still 100% straight. I was like, there's nothing to like do. We don't want to just do stuff just because, oh, it's been 2 years. Hi, thank you so much for your loves. So that's really, really nice without having to go through the downtime of a surgery, and you can see the results right then and there. Okay, those are some. Let me see if there's other questions that I'm missing. If you have questions, please let me know. Thank you guys for the hearts. Difference between PRFM and EZ Gel. So PRFM, there's something additive to that. With EZ Gel, it's not. It's all entirely from you. I really like that, but they're both going to make new collagen over time. But this with the EZ Gel, a lot of patients like that because there's nothing else mixed inside the tubes. It's all made from your growth factors and stem cells. But again, I will say, the healthier you are, the better your outcome. Okay, I've heard mixed reviews on Sculptra. What do you think of it? And is 29 too young? So I know I was talking to a patient about this today. I use Sculptra in our office. I don't use it a ton, but I definitely use it. So Sculptra is a collagen stimulator. I've had it in my temples. I like it. It was like a thing I kind of like got it done, I forgot about it, and then I was like, oh yeah, my temples don't look so hollow. It gets better over time as well. 6 to 8 weeks to see results, but you're gonna do anywhere from 2 to 4 sessions depending on. Hi Posh, I hope you're doing so well, hearts. That was fun watching the lives yesterday. 2 to 4 sessions depending on the areas you're treating, depending on your age, depending on how much volume loss you have. You gotta massage it right after injections, 5 minutes, 5 times a day for 5 days. So a little bit of homework with it, but it's like a gradual thing that gets better. Is it too young at 29? No. A lot of my patients are coming in their late 20s to early 30s when they're starting to see very subtle signs of aging. So this was me at 28. You know, I know people are like, oh my gosh, you look fine. I'm like, yeah, I look fine, but I also look hollow and sunken and tired. And like, you start to see some like signs of aging usually around that age. That's where a lot of people will see it. Nobody else is going to notice it on them, but they notice, they're starting to see the changes. So that's usually some ages. Sculptra, I like it. It's not like, to me, it's not like my most hyped up, like I love product, but I will say a lot of people love it. So it's worth a try. Depends on your goals. So I was talking to a patient today, like, what is your goal? If you just want some texture improvement, some overall like skin, you're just trying to get a little bit of collagen. Yes. If you have a lot of volume deficit, no, depends on what's going on. Okay. Hi, I hope you're doing so great. She is Anisha. Okay. If I want to lift my mid face and reduce smile lines, eye bags, would EZ Gel be the way for Kitty? Possibly, or filler. I got to see how much volume loss. If you're like really, really volume deficit, it might be more of like filler. So when it comes to filler, there's different ones that we have that are FDA approved in the US that we will use, that I will pick depending on who I'm treating, the area of the face I'm treating, what the outcome is, how much volume loss there is. So like I'm using a different product like in the cheeks versus the lips versus the chin versus the eyes. You know, some people, if like I showed you guys earlier, the guy that has like the really structured jawline, I need like a thicker product, something more sturdy versus like an older lady that just wants like to soften some lip lines. I'm going to use a thinner product. So back to Kitty, it depends on like how much volume loss you have. And if you want to see like quick results, if you want quick results, filler. And you know, you could bruise, you could swell, but you're going to be able to see the instant thing. If you're okay with it gradually up to 6 months for your body to make new collagen, that's when you can go with EZ Gel. Some people are using a little bit of both in different parts of their face, but hard to say 100% without like totally seeing you. I love EZ Gel. I love it. And I love regular filler. I love them all. I haven't had any traditional filler, hyaluronic acid, calcium filler for 3 years because I'm breastfeeding, but the natural one has been holding it down, and I'm happy with it, where I don't know if I'm going to go back. Like, I don't feel like there's any spot on my face that I'd have to go back to using filler. Now, I've done multiple sessions of it, and I've treated my whole face with the natural one the past couple years. Okay. Gosh, I know I talk too much, guys. Michelle, hey, I haven't seen you in a while. You're pregnant. Is EZ Gel safe for nursing? Love your work. I hope you're doing so great. I do it and I'm breastfeeding. I don't like promote it on here. Like usually I tell people, like, if you're pregnant breastfeeding, like just don't even come to the office. But I've been doing it breastfeeding this big baby, and I'm surprised he hasn't like knocked down the door yet, because there's nothing else mixed inside of it. So yeah. Ms. Vasquez, I love having a frozen face. Girl, I'm with you. I totally get it. It just looks fly. Nana Chuck, she said, is it okay to fly right after? Yes, I see patients for treatment. I ask them if they're doing regular filler that they stay in town for a day. So with traditional filler, I'm going to talk to you guys about like safety when it comes to it. With traditional filler, what we want to be mindful of is that we don't block off blood flow in the face. We got blood vessels, our whole face, our whole body. Think about, you've seen the body diagrams and all that. There's blood vessels everywhere. So when I'm injecting, I don't want to put too much filler anywhere, like into a blood vessel, or too much where it's blocking off blood flow. So when I'm injecting, I'm looking for your skin color to be normal, not paler than normal, not like staying pale. See how that turned yellow and it's kind of light, but it goes back to the brown? That's normal. I don't want it staying pale. I don't want you to have extreme pain. I hear my kids screaming. I don't want you to have any vision issues. If you had any of those, it could mean somehow we're blocking off blood flow. And at that point, we would need to dissolve the filler. I have never had to dissolve anybody for any emergent reason, any filler, any part of their face. And I've been doing this since 2013, and I do a lot of injections. Like this is my only thing that I do. This is all I specialize in. I don't have a different job. Like this is all I do. So I've never had to do that for anyone, but it is this rare risk that I want to be mindful of. So I ask these patients when they fly in, I'm like, just give me a day. If there's something weird, like we can catch it and I can take care of you. I just don't want you flying in and then getting right back on a flight. And if there was something weird, I got to try to find a provider out wherever you are to help us dissolve it. I don't want that. So again, I've never had to do that for anyone, but I just want to be careful. Skin treatments, you can go back same day. The natural filler, you can go back same day. No big issue. It's just with Botox, you can go back same day. But just with filler, I'm just like, just give me a day. Stay in town. Leave the next day. And we're just trying to I'm very extra, guys. I went to Stanford. I went to Duke. People like, oh, you're a Virgo. Like, I just want it to be safe. That's first and foremost. I want to have a beautiful outcome for you. That's the second option. So the second thing. Okay, these kids are about to be coming up here in a minute. Posh, thank you so much for your loves and for sharing. Okay, do I have a referral for DMV area? I don't off the top of my head, but I was giving tips earlier. I have to think about that one. There's not a lot of people there. Like I said, consult, look at their work, read their reviews. Don't rush just picking somebody. Like it's your face, take the time. The shiny forehead is the best feeling ever. My friends are like, why is your face always glowing? I know. I love that's some Botox for you. People don't get it until they get it. And then once they had it, then they understand and they love it. What about filler for hands? Yes, you can totally do that. You can do dilute radius. You can do hyaluronic acid fillers. You can do the natural filler in the hands. Also your skin treatments, your sunscreen, your retinols you can do, but definitely sunscreen at the very least and moisturizing. Okay. I saw a question earlier. It's asking about, treatments. They're going fast, so I can't see them all. Treatments for hair loss. So in our office, we have a whole hair health program, also led by our dermatology nurse practitioner, Niani, Black dermatology nurse practitioner in our office. Guys, you got to come see. The team is excellent. You guys think I'm extra? Like these girls are excellent. They're going to get loud. So if it gets too loud, I'm going to hang up because they're about to start their bath. My husband's going to do that. So in the hair health program, we get you on supplements and or prescriptions, minoxidil, topical, oral or topical if you want. We do a scalp detox facial. So cleaning out any debris, blocking the follicles from growing, sweat, oil, product. We want to clean out the follicle, debride the area so the follicle can grow. We have a massage, head massage, and red light therapy that we put you under right after your facial. At that same time, we're drawing your blood and then we're spinning it and we're separating out your growth factors, your stem cells, your PRF, and then we're injecting it where you're noticing hair loss, hair thinning. I have some really good before and afters. I just haven't set them up on here. Great for all textures. So I've done straight, curly, nappy, every texture, braids, non-braid. Like I've done all the textures. Patients really like that treatment. Helps with hair growth. I would say a minimum of 3 treatments. If you have a lot of hair loss, we're going to be doing closer to 6. Just depends on what's going on. Okay, guys, I'm trying to hit all of these and I'm going to miss them because what about filler for hands? Botox every 3 to 4 months. Do you think I should do anything more, Ms. Vasquez? Your sunscreen, your retinoid, skin treatments. I think at least doing those. And then depending on like concerns, I would do the natural filler for just like spots to think about, guys, where our face is aging and people don't think about it until it's like, oh, really deep. So what's happening as we age? I'm thinking about underneath the skin, where are we losing volume? We lose volume underneath the eyes and our fat pads start to separate. So people will start to notice a line from their under eyes and it'll start to cut through the cheeks. So start looking at faces when you go outside, you'll see. So under eyes from here to here, they'll get a line here. And then the smile lines get deeper. So the line gets here. So these fat pads are separating, these are here. Then these start sinking down. So you get this line, and then the corners of the mouth start to turn down like that. Also, we lose bone right here. So our chins start to set back. This is all like me understanding anatomy and studying faces and aging. We lose bone right here. So this is the deepest part of the smile line. So this starts to step back. And then we lose bone in our temples. And this starts to look like a little cone heady. So when I'm injecting, that's how I'm injecting. I'm thinking about the skull. I'm thinking about where we lose bone, where we lose fat, all of those things. So then the people look natural. Like, again, I can flip through these photos. They look natural. They look like themselves. It doesn't look weird. Like, but we'll be hitting up their whole face. Oh, he did a hair treatment program. He has good before and afters. That's how we inject. So it still looks like them and not crazy. It doesn't look weird. Though that's what I'm thinking about. But I would say you can think about doing the natural filler or a collagen stimulator in those areas. And it is good to kind of start, you know, in your 30s, like start before it gets super deep. And it's like way, you know, when you come in and you've never done anything and you're in your 60s, like you just have way more volume loss. So it just takes more to try to like correct. So I'm like, if you can do preventative measures with the natural filler, I think it's really nice. I love all the things. And these are just, like I said, a few that I kind of screenshot on my phone so I can click through here. But we have hundreds, thousands of patients who have consented their photos to like share. So these are just some, but that's how we inject so it doesn't look weird. It looks like you. And we don't want all the faces looking the same. I think a lot of injectors will just be like, oh, cheeks. Like, oh, if I put more in the cheeks, it's going to take away the smile lines. It's not, guys. Like we want to like and then they build this up and then they're sunken above. It looks off and their chins are back and like we walk around, we're like, oh, they got filler. I can totally tell they look bad. It's just almost like it's unfinished and it's like overdone and they're only treating a certain part of the face. And so everything else looks aged except that one part that they're treating. Same goes for lips, guys. I know you've all seen it, you know, big lips. And then they got these sad lines right here, but big lips, and then their chin is set back and it looks ducky. Yeah, because they're only thinking about one spot, just the lips. No, we got to think about the full face. And we got to think about not just from the front, but from all the different angles. I tell the patients when I'm doing, I'm like, I'm looking at you from all the different things. I'm looking at you with different lighting. I'm looking at you with different expressions. I'm watching your face, how you move, how you talk. I'm looking at these little asymmetries. I'm not trying to fix it, make everything completely symmetric, but I will ask, hey, naturally you raise this brow more than the other. Do you like that? Some people like it. The Rock wants to do that. Other people don't. They say try to make them balance. So there's a lot that goes into it. Sorry, I've been talking too much. I've been talking too much. Oh, she already said she's doing tretinoin, vitamin C, sunscreen. Perfect. That's just about, you know, we're not trying to do too much. Am I doing training right now, Roxanne? I'm not. You see, I talk too much. Girl, I give like 5,000,000% to everything I do to my patients. And then when I'm not doing patients, I'm running the clinic and doing social, trying to educate. So I'm not. I have done training programs in the past. I've helped people set up their clinics. I've helped people start from zero, from like, they don't even know how to inject it all. And like they are fully booked out or they have fully booked out their own clinics. It just takes time. That's the only thing I would say. It just takes time. Find somebody that can like give you the time. And I love to do it. It's just, I just don't have all the time in this moment. Okay. Let me see. Okay. If, do I take mentees, you know, here and there? Sometimes I'm like, if you are so cool and like going to be a great vibe for the office, but it gets hard. Like, I don't have time for people playing around. Cause like when I'm in clinic, I'm like forward facing with the patients, there to serve the patients. And here and there, I've had people like, oh, please, can you let my daughter shadow? And then she comes and she's like eating Cheetos. And I'm like, this does not even look professional. Like, that's not what I'm trying to do. Like playing around in the room. I'm like, this is not your time. This is the time for the patient. So it just really depends on the person. But right now, not in this moment. Suggestions on medical grade skincare products. Use our line, our Jossie skin line. I don't even have it linked on here, but if it's through our website and I love it. It's all I use and we use it it's used like in conjunction with the treatments and the patient's skin. Great transformations. I love it. We also will do like prescription retinoid if they've already used a retinol. Why is it recommended to have 3 rounds of microneedling? So DivaFit, so that's like probably minimum. So just think for all of these things, none of this is one and done when you do it. Even if you think about a facelift, you know, like people will get another facelift in their life, depending on what age they get it. But all of this takes maintenance. Just like when we get a haircut, we get our hair done, just anything that takes maintenance. People get their lashes, their nails, same sort of thing. Your skin cells are renewing. They're going to be turning over, you know, in a month. So it depends on what we're doing. If people come in and they're like, hey, I've got acne scars, one treatment is not going to like take away those scars. If they're like, I've got dark spots, those dark spots did not happen overnight. And so it's like one treatment is not going to do it. You want to be doing your skin treatments in conjunction with your skincare. That's a big part of it. So we do the skin treatments when I'm like, at home, we've got you on a regimen, or like, you got to do this. And we can also tell if you're doing it because we'll be able to see the health of your skin. We can tell it when we're doing microneedling. I can tell. Usually someone's first time, they're a little bit more, they're bleeding a little bit more. Their skin is more reactive. After they do some more treatments, I'm like, wow, I can tell the health of your skin. You're not so bleedy. It's just your healing time, your recovery is better. So we can totally tell. But all of these things require maintenance. That's the biggest thing with it. Let me take one sip of water, and I'm probably gonna get these babies. Shantae said, how long does Botox last? It depends on how much you're doing. Most people, like the guidelines they did for the FDA, most people are going to get 3 to 4 months out of it, but it depends on your dose. The stronger the dose, like the more that you do, the longer it lasts. The less that you do, the quicker it wears off. So some people will do less. Like I have people that I'm in acting, I still need a frown, but I just don't want to have the lines as aggressive. So I go light on their dose, but it wears off kind of quick because we didn't like fully restrict those muscles. I have other people like, Ginille, I can come to see you twice a year, freeze my face. I can come once a year, freeze my face. So I will do a lot more. I can, even on myself, I got it to last for a year before. This was in 2020, but I'm doing like way more than the normal dose. So it'll hang on longer, but you're a little bit more frozen. But in general, 3 to 4 months, most people are doing this around 3 times a year. Is a chemical peel or aerolase a better option for hormonal hyperpigmentation, melasma? Biggest thing, Crystal, for that is going to be trying to avoid, like melasma, there's nothing to completely cure melasma, which sucks. It's tricky to treat. You want to avoid the triggers, avoid sun, avoid heat, because that's going to trigger and flare it up. They're both good, and we use them both in the office. I would say, I mean, they're both great. Like the laser is not like a ton of heat with it, but I will apply ice after I do it just to be extra safe. I've never had anybody say it's got worse, but I want to be really mindful. You could do either. The chemical peel is nice as long as you're like avoiding the sun. Use your sunscreen. Use your tretinoin, and we also will do a prescription fading cream for patients that they can use short term. But unfortunately, there's no complete solve for it. Okay, let me. Sorry. If there's any recommendations for Bakersfield, no, but you're close enough. Bakersfield, you're right here. I see a lot of people from there. Would Botox help with downward pointing nose? Possibly, if you smile and your nose like goes down, like curves, it'll stop it from flexing so much. It doesn't last a ton of time, a few months. But if you want something to like last longer, that's when we're doing your filler. And so here's a couple noses. I showed those earlier. So with the nose filler, you can camouflage a bump, lift the tip of it. You can create a highlight down the center of it. So those are some noses. And you can see when she's smiling on both of these, the first one, her nose was curving. The second one was up. I can't get this dramatic of a result with Botox, but it does prevent it from like twitching so much, like from like the muscle from flexing. Okay, let me see. What do I think about BioRePeel? Is my favorite. Oh my goodness, I love that. I love that peel, and I've been doing it the past, I don't know, 4 months, like once or twice a month. I said this on live the other day. I was like, my husband, who never can tell any difference with any treatment I do for him, the peel he asked me for on a routine, like 2 to 3 weeks. He'll be like, can we do that again? Can we do that again? I'm like, why are you asking for this? I thought you can't tell any changes with anything I do. He's like, no, the peel makes me look rich. So I love the peel, safe for all skin types and tones. Anything I talk about, guys, is safe for all skin types and all skin tones. I am Filipino and Black. If you come to our office, we've got all colors of the rainbow. I try to show you, like, these are our patients. You will see an old white lady, a young Black girl, a middle-aged Latin woman. I see all of the Asian woman, an Indian girl. I see all, and a man. We see everybody. So we see everyone. Anything I do needs to be safe for all skin types and tones. We can combine. We've got the aerolase laser. We've got the skin pin microneedling, the hydrofacial, the BioRePeel. So we have a whole membership program. People will come in. They'll come in on a monthly basis, and then we're using one of those 4 treatments, depending on their skin concerns and their goals, as their base treatment for that month. Now, if they want to do more treatments that month, they can. If they want to do more treatments that day, they can. Those treatments you can stack. So, you know, today I did somebody like her laser, and then she did the hydrofacial and the pill right after. So you can do a lot of our patients. majority of our patients, gosh, you know, you guys hear those babies. A majority of our patients are stacking, like combining these. We're working on different layers, different depths in the skin, trying to target different things with the different modalities. But you come in on a monthly basis. It's $3.99 for that monthly treatment. If you want to add on your neck and chest, it's $250. If you add on a second treatment, it's $250. Once they start in that program and they start seeing their skin glow, they're just like, I'm here forever. They love it. Like, I feel like the skin glowing is just the best thing. But anyway, I love the BioRePeel. It's just my favorite. And I don't want to say favorite. I don't want to say favorite because I love them all. I don't want to say favorite, but it's been really good. Is it hard to book with me personally? No, we just got to do the consult. I just want to make sure we start writing out your treatment plan, and I want you to be prepped, because when I'm there, I'm seeing my patients, they are ready. They are set. I don't want them to be like, I don't know. Oh, I can bruise. I don't want to do it today because I got this thing tomorrow. So that's why I'll consult with the patients just so they can be ready. Start developing that treatment plan. We send you information about everything we discuss. We send you pricing, financing. So they are ready. We start developing that timeline. So it's like, oh, when is your event? I have this long. Okay, this is when we should do it. This is when we should do your follow-up. We are talking through all of the things before they come into clinic. So when they come into clinic, like, it's just time for me to be like, hey, let's go through this one more time. This is what we discussed. This is what we agree on. Now let me look at you. Let me feel you. Da, da, da. Okay, this sounds good. Let's go with the plan that we discussed. Usually, like, I've been doing these virtual consults for 5 years. Almost 6. And I, like, what we say online, I can usually have a very, very strong assessment from just discussing, from us just talking and me being able to see you. Now, if you come in and your light is really bad and I can't see your face and it's like this, I'm like, okay, I need you to send me photos. Like, I can't see what I need to see, and I need to see it from different angles. But yes, you can totally book with me. I just want to have you prepped. Okay, I'm from Trinidad. How can I get an appointment? Through the number. You can text. Oh, usually from our people from international, they can't text our number. You can email. Or if your number does text, that'll be great. You can email or through the booking link. So you can do it through there. Bubbles, peptides. Yes, in our office, we've got Zepbound. I really like that for weight loss and medically supervised weight loss program. Recommendations for RBF sad face. I'm tired of people asking me if I'm okay. So if it's mad face, then we want to do Botox. Botox will relax these muscles from flexing so hard. And so then it smooths out. If it's this mad face, we can either do Botox, or sometimes if it's like the depth of the line, we'll do filler to soften into that area so it doesn't look so deep and look downturned and sad. So it could be that. Tired of people asking if I'm okay. They need to be quiet. They don't need to be saying nothing to you. Do I recommend microneedling or dermaplaning or laser with BioRePeel? I kind of all of them, but it really depends on what's going on. Before I can say to do these, like, I gotta like ask you a whole host of other questions on what you're using and what you've tried, what you felt, what your goals are. And I gotta see you and I gotta look at your skin. But all of these treatments are excellent and we do them in the office. But when we're determining which one to do or to start with, I don't usually start with, if you've never done anything, I don't usually start stacking your first time. I need to see how your skin responds, and then we might test a different one, see how your skin responds, and then decide if, okay, can we do these all in the same day? But they're all really great. If they come in and they're really complaining about acne, I really go with the laser. I think the laser works very well for acne and for dark skin. For hair removal, the laser. For DPNs, the little moles, the laser. For pigment, for brightening, they all work for these things. But like, this is where I think they shine. For pigment and brightening, the chemical peel. But you can do the chemical peel for acne too. For textured scars, for acne scars, microneedling. Fine lines, microneedling. But again, they all work, but it depends on like what's going on. And then I might say, hey, now once we get your acne under control, we're going to, move on to doing the laser plus the microneedling. So that's why we got to kind of like do the plan. Oh, someone just said they got their first PRP and microneedling. Uno reverse. I like that. I think you're going to love it. And then once you see that skin glow, people, and maintain it. So stay out of the sun. Use your retinol. Don't use your retinol right now. Like, let this heal. And then you want to use your retinoid. But staying out of the sun, following all your pre and post care is big. So guys, you think I talk a lot? Imagine the team, they're all saying the same thing. Plus, we're giving you everything in writing and sending you videos. We want you to be informed, not rushed on your decisions. Like, we want this to be well thought out. Any recommendations? This is for Angela. Any other recommendations for smile lines besides filler, the natural filler, the one made when we draw your blood, we make it out of your growth factors and stem cells. When we place it there, it's going to make new collagen over time. Nothing synthetic in it. All made from you. The younger and healthier you are, the better the outcome. But I really like that. Keisha was also saying smile lines. People always want to know smile lines. You can use regular filler if you want like the instant fix. If you're like, these lines are bothering me, I need to see it right now. Traditional filler. If you're okay with, you want it being from you and you're like, I don't want anything, I don't know what those fillers are, I don't want that, I only made it for me, then we'll do the natural one. But they're both great. And when we do smile lines, guys, here's a few things to keep in mind. I tell patients when we're doing smile lines, my goal is to not get these smile lines all the way gone. If I get the smile lines all the way gone, it's gonna look weird. It's gonna look puffy. It's gonna look like baboon, that monkey is gonna look bad. You don't want to have no smile line. Also, when we're doing the smile lines, we're not just thinking about here, but also the corners of the mouth. You don't want to just do this and then sad corners here. So we want to hit there. Also, what is causing these lines? So that's where we're losing volume. Here, fat pads are separated, everything is starting to push down. So sometimes it's not just the smile lines that we're trying to fill, but we're looking at these other areas. Have you lost volume through your mid-face, through your temples? Do we need to hit those areas up too? Because you don't want to just have these lines filled out within saggy cheeks. It's going to look bad. We don't want that. We don't want it to look weird. We don't want people staring too long because it's like, what is going on? They can tell something is off. They can tell you did something because it just looks weird. That's not it. And when we do things, gosh, I'm talking too much. When we do things, I always tell people, I'm like, do some, let it settle, reassess. 6 to 8 weeks later, we can always add more later. We don't want to overdo with this stuff. I love Botox. I love fillers. I love all the things I offer in the office. I would not be here telling you about them if I didn't fully believe in them and love them. However, I'm like, you want to understand there's limitations with it. You know, it's not, these things are not going to give you a facelift. That's something to keep in mind. I will tell you straight up, no, it's not going to do what you're describing. We need it to settle. We don't want to overfill because you guys have all seen it. It looks so bad when people are overdone. I'm like, I'd rather you have a little bit of a line than like me having no line, but it looks weird. That's not going to look right. Now, if you here and there, I get somebody that's like, you know, their aesthetic is there. Like, I'm crazy. They basically say, I'm crazy. I want to look altered. I mean, this is very rare that we have anybody in this office, but here and there, somebody will come to me and say that once every few years, and they want to look crazy. And so they just want it to be overfilled, but like, nah, like the majority of their patients, 99.999, they want to look natural. They want to look like themselves. They want to look refreshed. They don't want to look overdone. And so we do things slow. We don't rush it. I know the timelines for this stuff, guys. Guys, I need this to be good because if it doesn't look good, like I got to be taking care of it. I don't want that. I want it to be good. I want it to be done the right way. I'm like, trust me, I've been doing it long enough. Like, I know how long it takes for this stuff to settle. I know, oh my gosh, should I dissolve it? I'm like, you're talking to me 2 days later. We just did it. No, you are swollen. Let that settle. Talk to me in a few weeks and then we'll see. And then it settles. They're like, oh, should I do more? I'm like, slow your roll. Nope, now you got to wait 6 to 8 weeks, completely let it settle. Then we can decide if we should do more. So when I do these things, even this guy, all these people, I see them in sessions. I'm like, let it settle. Come back. We can do more later. It's not going to stay so exaggerated. It's going to come down a little bit, but I can build on it later. I don't want to just overdo. Okay, sorry, guys. I'm not yelling at you. I love it. I love what I do. I just want people to understand because I know so many people look weird and like, we don't want to look weird, dude. Nobody who wants to be looking bad. No, and like to be investing your money to look weird, that's not it. Okay. It says 31 messages. How long does it take for Botox to work in? Is it Botox, Lima? These are all Botox filler skin treatments, non-surgical treatments. For Botox, a few days to kick in after you get your injection. So when you do Botox, you come in. I'm going to assess your muscles. Okay, let me see. Frown. I'm trying to see where the muscles are flexing. I'm trying to see where you're having lines. I'm going to tell you, hey, you know, some people when they smile, like, oh, I got smile lines way down here. I'm like, I can't get all of those. If I start chasing it, it's going to hit other muscles. You won't be able to lift your cheeks. So I'll tell you limitations. I'll tell you what to expect. We can show you pictures, all of that. When you do it, it's like pokes. like tiny little pokes, feels like bee stings. We give you ice. I have a person in the office, they're tapping your shoulder. It's distracting you from the pokes. I know it sounds weird. All the patients are like, oh my gosh, that actually helps. I'm like, I know, it's a good little technique there. Injections take like 5 minutes. It is, I'm going through it pretty, it's not a big deal. It'll look like bee stings for like 15 to 20 minutes. You don't touch it. I don't want you rubbing it to a spot I didn't do. So then your brows are, no, just leave your hands off. Stay upright for 4 hours. Don't go to a sauna. Don't exercise. No hats. Like just leave your hands off. Stay upright. Now, then you give it a few days to start kicking in. So then over a few days, you'll be like, oh, I can't like frown as hard. Like it's not, oh, wow. You can like see it gradually kicking in. It takes 2 weeks for the full effect. So at 2 weeks, you're like, oh, wow, like you'll have less frown movement than you did, 3 days in. After 2 weeks is when we can reassess. So I say, hey, give me feedback at 2 weeks. If you decided, hey, I want to start with a light dose, and you're like, then the light dose kicks in and you're like, actually, I want these more smoothed out. We can always do more. You just don't rush it. So the dose, like how much you do, depends on how strong your muscles are, how big the area is. If you got a big forehead, you're going to do more. If you got a tiny forehead, you're going to do less. And then what do you want the outcome to be? If you want to be more restricted, more frozen, you're going to do more. If you just want to like soften little baby bits, you're going to do less. So hopefully that helps. I haven't been talking too much. Is it safe to do Botox under your eyes? Very, very light. So some people, when they smile, they get like little lines here. They have like a lot. You can do like small bits. You don't want to Botox too much underneath or it'll like weaken the muscle and you smile and like you'll pull your eyelid down. So very, very light. Will Botox help if one eye appears smaller in pictures? Possibly. So around the eyes, this is a circle muscle. It closes in like this. So some people, when they smile, like one side closes in more. When you Botox this, the normal function of the muscle is to close in. So when you Botox it, instead of it closing in so forcefully, it's going to help give a little bit of a lift. It's going to soften those crow's feet or smile lines. So could be that. Oh, Lima, I wish I was where you are at too. Okay. Let me see if there's other ones. I went for a consult and the lady said nose lift Botox are subtle. I agree. And that my nose won't lift. It's subtle. My husband's starting to yell. These old babies are fighting already. These babies are crazy. So it's not going to give you, Botox is not going to give you that. It is subtle. Some people really like it, but it's not going to like give a huge lift. Those are more done with filler. Okay, I'm going to go get these babies. They're crying. Opinion on lip fillers versus lip flips. Lip filler is going to hydrate, plump, volumize, can work on your shape. Lip flip will prevent that's Botox. If you smile and your lip curls under, Botox will prevent that curling under. Y'all hear these babies crying. Can I have $3,000? I know. And some people are doing Botox and they're doing lip flip. Okay, I'm sorry guys. These babies are hollering. This is their red time. Okay, if you have more questions, call or text the number on the top of my page. You can book your consults there. We're in LA, so Torrance and Mar Vista, and then we're in it's saying I've been on TikTok too long. Or we're in the Summerlin side of Las Vegas. I go to Vegas once or twice a month, but we have a whole team. We have teams in all these spots, and these girls on the team are excellent. I would not put you on to people that weren't excellent because they're going to be a reflection of me. If they mess up, I got to take care of it. No, these girls are amazing. You will love all of them. I'll be in Vegas on December 11th. So that when I'm in Vegas, I'm seeing patients, like I come for the day and then I come home to get these babies over here. So if you have other questions, please let me know. I appreciate you. I will try to be on tomorrow. Thank you so much for coming. God bless you all. And I will talk to you soon.